Welcome Dr. Guru Murugan sir. Greetings to all. I request Dr. Vikash Agarwal to start the program.
Good evening, everybody, and happy World Physiotherapy Day to everyone available over here. I, on behalf of Lions Club of Rourkela Prime, welcome you all to this fantastic session of physiotherapy. I believe I am audible to everyone. Hello.
आवाज आ रही
Thank you. So, just before coming up, I'll just share something about this World Physical Therapy Day. This is actually celebrated on 8th September today, every year. And this day is an opportunity for physiotherapists from all over the world to raise awareness about the crucial contribution the profession makes to keeping people well, mobile, and independent. In 1996, the World Confederation of Physical Therapy designated 8th September as World Physical Therapy. This day marks the unity and solidarity of the global physiotherapy community. It is an opportunity to recognize the work that physiotherapists do for their patients and community. Using World Physical Therapy Day or World Physiotherapy Day as a focus to support member organizations in their efforts to promote the profession and advance their expertise. I'm very thankful. We have a very delightful and fantastic speakers and highly experienced people from different parts of the country who will be sharing a lot of knowledge regarding physiotherapy, which will be helping us in developing our wellness during this COVID times. I welcome Dr. S. Sundar, Dr. A. Guru Murugan Arsan, Dr. S. Kavita, and Dr. B. R. J. Satish Kumar. I also welcome Dr. Mr. A.Mahalingam, and it's a great opportunity that Twin Tech Academy, along with Lions Club Prime, this is the second activity which we are doing in a month's time. And during the session, I welcome our Vice District Governor, Lion Dr. Lion R.K. Singh ji, that he is right now in London and he has joined this event. So thank you, sir, and thank you all the speakers. And we look forward to learn a lot of things from you this particular session, which we'll be able to implement in life, because this COVID has made everyone learn many things. So it will be it is a great blessing for all of us that you are with us. And now I request Dr. Mahalingam to move further with the session. Over to Mahalingam, sir.
Thank you, Dr. Vikash. And today also happened to be the World Literacy Day. So on this occasion, we'll also thank and greeting to all the teachers and children on this happy occasion too. So as per the agenda, we have 4 eminent speakers: Dr. Sundar, Dr. Guru Murugan, Dr. Kavita, and Dr. Sadish, orthopedic surgeon. So first talk, an inaugural talk by Dr. Sundar. So we'll give a brief introduction about Dr. Sundar, and we request Dr. Sundar to carry on his presentation.
Indeed a privilege and pleasure to welcome Dr. Sundar. Dr. Sundar, fondly called as the medical trailblazer, is a medical graduate from Stanley Medical College and holds a postgraduate degree in
Hello,
the field of physical
am I
medicine
audible
and
to everyone?
rehabilitation.
Yes, sir.
He specializes
So
in
I'll share my
ergonomics and in rehabilitating the handicapped.
screen.
He is the founder
Just 1 second, sir. Let the profile is it to complete.
Okay, right.
medical director of the Prem Center for Physiotherapy and Rehabilitation Medicine in Chennai, which is one of the largest centers of its kind in the city. He was until recently senior consultant and the head of Department of Physical Medicine and Rehabilitation in Global Health City. He has been visiting faculty in the subject of rehabilitation to several colleges and has been the editor of the Bulletin of the Indian Association of Physical Medicine and Rehabilitation. He is one of the few physiatrists in the field of ergonomics and has done more than 400 programs on office ergonomics among computer professionals. He has been industrial medical consultant to several companies and has served as president of Indian Association of Occupational Health Tamil Nadu branch. He has presented several papers and chaired several scientific sessions in national and international conferences and has delivered several prestigious national orations. He founded the Freedom Trust under which banner he conducts regular camps for the physically disabled and gives away mobility aids. Over 25,000 physically challenged persons all over India have received mobility aids from the trust. In recognition of his services, he received the coveted President's Award for Best Individual in Social Service in the year 2008 and the Tamil Nadu State Award for Best Doctor. In 2017, on World Disability Day, he was awarded the Lifetime Achievement Award by Chief Secretary Tamil Nadu. Several other organizations have honored him for his valuable contribution to the society. Over to you, sir.
Thank you, sir. Just you can do your presentation on the given topic.
So I will share my screen now.
Yes, sir. Yes, we are able to see the PPT set.
It's visible now, right?
Yeah.
Good evening, everyone.
Good evening, sir.
Good evening. I just have a small request that those who are not speaking can mute themselves so that I come out loud and clear. So when Mr. Mahalingam asked me to speak on the occasion of World Physiotherapy Day, first I'm going to start with wishing everyone on this occasion. And a lot of the work of physiotherapy deals with pain. And so that's why I titled my talk as Pain, Pain, Go Away. After the common rhyme that we say, rain, rain, go away, come again another day. But none of us ever wishes pain to come back again. So we need to look at how to prevent pain. Once pain comes, we go to a doctor or we go to a physiotherapist and get our pain relief. But my talk today would be about how to prevent pain due to ergonomics. We'll come to the topic of ergonomics a little later. But we must know that in this slide, we can see how man has evolved. And from the ape down to the industrial revolution, there has been a lot of activity. But today, as you can see here, a person sits at work for so long. In fact, they say 75% of the world today is sitting at work. And not only do they sit at work, it's a continuous sitting for over 8 to 12 hours a day sometimes. And so this is the this is a joke, of course. The people have designed the workstation of the future where people don't even have to get up to do anything. So I have done a lot of programs for IT professionals and a lot of people who sit on the computer. Let's not think that it's only for IT professionals or software people. It's this talk is for anybody because most of us today anyway sit at work. So many of us are young. We spend long hours at work, and our posture we don't really take care of. And we, of course, travel long distances, not, of course, during this period, but otherwise, several of us travel to work. We do not exercise. We say we don't have time to do exercise. And this leads to various symptoms. It's not just pain, but also people get anxious when they get other symptoms like tightness or discomfort, sometimes a stiffness, a burning sensation, a need to massage your hands, clumsiness, and sometimes a lot of neurological problems overlap on these spectrum of complaints. And so the patient comes to his doctor or physiotherapist with these complaints, and we need to take care of it, because when we educate the patient, it's not, sometimes everything is normal. When we see the x-rays or when we see the MRIs, it might be even normal, and the patient has to be explained that this is because of a friction, a wear and tear or damage to the soft tissues of the body. We often expect that there will be some problem in the x-ray, some infection, some abscess, some space occupying lesion, cervical spondylosis. We always feel that there must be a diagnosis which is related to the bones, but very often it's the soft tissues, the tendons, the muscles, the ligaments, which are overstrained and causing these problems. So my talk is about repetitive strain or repetitive stress injury. There are many names, other synonyms for this: musculoskeletal disorders, occupational overuse syndrome. So many names are there. But basically, it is pain related to work. And we must remember at least 1/3 of our life is spent at work. Even there are people who say, I work out of home. But then are you working in the right posture? Are you using the right ergonomic furniture that are needed to prevent these sort of pains? Because once the pain comes, there's no software repair wizard to treat the software of your body. You need to actually look at how you sit and work. And what is this preventive package that I'm talking about is, one, of course, we need to get treated. And but once you do that, proper ergonomics workstation, proper posture, and proper exercises, because it's far easier to prevent. So in my lectures to the IT professionals, I tell them, see, there's no point saying you've got the pain and then come to treat it. Might as well anticipate these problems. So why do I put this slide on my presentation? Is because barring the gorilla that you see on the left, every other animal in the world, other than man, of course, every other animal in the world walks on 4 legs, and once walks or runs on 4 legs. So this causes certain physiological, or let us say biomechanical changes or effects on the body, about which I won't go into detail, but basically it is related to the spine of our system. Now, because back pain is very common, we get, there are statistics which say 80% of people at work are prone to get back pain. We need to prevent it, because, and how do we prevent it? We need to know what is the structure of the back. We must know that the back is essentially the spinal or the vertebral column, which is made up of bones called vertebrae, and the spinal cord runs within these vertebrae, and that these white things that you see here are the discs, the intervertebral discs, and these are all supported by a system of muscles and ligaments which bind all these bones together. Now, why am I saying all this? Is because we need the flexibility and at the same time the stability for the spine, which we do not get if we sit for too long or if we stand for too long. We tend to strain all these ligaments and the muscles, which have to maintain the vertebral column or the spine in the right position. Now, there are 3 curves in the spine. the neck
Very
curve,
nice work.
the upper back curve, and the lower back curve. We have technical names for these: the cervical, the thoracic, and the lumbar. But why I'm telling you about all this is these curves have to be maintained properly. If somebody sits or slouches in the wrong positions,
Beautiful.
one is prone to develop a chronic back or a neck pain. In fact, people have studied here on the left. You can see people have studied the intervertebral disc pressures. Obviously, we all know that the most comfortable position is when we are lying down. When, let us assume the disc pressure is X or 25%, this pressure shoots up every time one leans forward while sitting or bends forward while standing. How does this impact the spinal column, the vertebral column or the spine? Is that these discs here are subject to such pressures, and sometimes the pressure may be so much that it can actually come out and compress one of these nerves. And in some patients, we actually can diagnose a disc prolapse or sciatica, which is actually a sometimes goes into surgery. So without further ado, we need to look at good postures. As I told you earlier, the body is made up of these curves, and these curves are there. Though our spine is absolutely straight when looked at in the antero-posterior line, but when you look at the side or on the profile, there are these curves. You can actually feel them on your own body. So the good posture while standing is to maintain these curves in a straight line. Unfortunately, some of us who are very tall or people who are used to slouching, they develop this sway back and a bad posture, and these curves become exaggerated. Sometimes on X-ray also, we are able to see the changes, like an exaggerated um, uh, curve like this, or a straightening of the lower back, and so on. Now, before going into other things, let us look at how to actually prevent. A lot of people think that when there is back pain, it is only the back muscles that are involved. Yes, it is. That is also true in many ways, but you must also remember that a good abdominal muscle tone is also important. And when people tend to lose that, when they become obese, then the abdominal tone is not enough, and then they become obese, and the sort of pressures that happen, uh, the vectors of the forces that act on the lower back are more. And this obesity is not, it's not uncommon. It's highly prevalent among the working population today, primarily because of our posture, eating habits, and lack of exercise. Also, sudden and unplanned lifting. Suppose you don't plan what you lift, you are again likely to get into a risk of low back ache. So, how do you lift an object? Is instead of bending forward and lifting like this, your physician or therapist will advise you to keep your lower back, your entire back absolutely neutral or straight, and use your strong muscles of your hip and knee to straighten your back. The common tendency when you lift any object, be it a shopping bag or your own child, is to just bend and lift like this. And so, one of the good ways to prevent low back ache is to know how to lift. And actually, you need to lift close to your body, as close. And lifting is not the only thing. Even when you place this object down, wherever you want to place it, you got to be quite careful. I do a lot of industrial ergonomics, and a lot of workers are not well trained, especially in the unorganized sector. They are not well trained on how to lift objects. So, primary thing in preventing, and you must remember, backache is one of the highest causes of absenteeism in the industry. So, a lot of people miss out on their work. They're not able to go to work because of their back pain, back problems. So, good lifting is primary for the working person. So, we talked about standing and lifting, but now we need to look about lying down. Obviously, the lying down is a position where the whole body is relaxed. So we tell our patients to select a mattress which is firm. and not too soft or too hard. And we ask the patient to choose a very thin pillow for the head and a pillow for the to be placed between the knees, and to lie on the side while sleeping. This is a preferred position. Of course, at night you would have to keep twisting and tossing, but at least the starting position should be a comfortable position. Use a firm mattress instead of a very soft and springy one or a very hard one. If you would like to sleep supine, that is lying face up, you lie with your knees flexed or folded like this, or in this region under the knees, you can place a couple of pillows which will support the lower back. Also remember, as you're lying face up, to support the back of your neck, use a folded towel and use a very thin pillow. It's not that you have to deny yourself the comfort of a good pillow also. Remember, it's not just low back, but also the neck. And today, with continuous usage of the laptop and the mobile, I'm finding more and more and more patients coming to me with a neck pain. And this is because all of us have head weight. And the head weight is something like 6 to 8 kilograms. All of it just in a very fine balance on two small bones in the upper part of the neck. Now you must remember, when such a wonderful miracle of engineering called the head is balanced on such a small thing, what is the purpose is that we are able to use it by turning up, down, sideways, and so on. And this was very, very useful when humans were animals. When you had to run away from a predator, or when you were running towards, as a hunter. But now all of us are continuously focusing on a screen. And sometimes the screen is not directly in front of you. It may be on the side or it may be above. And like when you're watching TV, all these things cause a lot of unnecessary constant contraction of unwanted muscles supporting the head. Now this is okay once in a while, you got to turn, you got to look, but a constant maintenance of this contraction can lead to strain, spasm, and therefore pain around the neck. I'm not going into detail on the diagnosis. Now, diagnosis is a total different thing. I'm not talking of other causes of neck or back pain. There may be an infection, a tuberculosis of the spine, or there may be so many other causes for back pain about which I'm not going into. These are the basic ergonomic causes which can be easily prevented. Basically, you keep your monitor just in front of you instead of twisting it. Or I've seen people even driving two-wheelers with the mobile on their shoulders. Now, this is actually a prescription for getting neck pain, because you are keeping your neck in a prolonged, maintained asymmetric position. Though we have flexibility for the neck, we are abusing it by keeping it in an asymmetric position for too long. In the long term, these people can develop chronic pain, and the vertebrae also can get affected in the long term. So this is some guidance about office ergonomics. So especially for those who are now working from home, I keep asking my patients, you're working from home, fine, but do you maintain the same work discipline that you maintain at home? No, sir, I sit on my bed while working. No, sir, I sit on the sofa. Sir, I sit on the ground and keep my laptop on a sofa. So these are ways by which people just feel that they're still working and being productive, but they are actually abusing their back and neck. So let's run through briefly. The ergonomics basically is that you sit with your feet placed on the ground. Keep a 1.5 to 2 inch distance between your eyes and the monitor. Keep your documents, if you need any source documents, at the same height and distance as the screen. See that you are not bending too much down or up. It should be at or slightly below eye level, that you keep the top of your monitor. Now, in case of a desktop, you can actually have a different keyboard, and it is detached from the desktop. But in laptops, the keyboard is attached to it, and therefore we might have to, for long term working, people work on laptops for very many hours, so it is better to use a USB keyboard and a USB mouse. Remember that when you place the mouse, it should be at the same level as the keyboard. So what level will you keep the keyboard and mouse? It should be at about elbow height. If your shoulders are relaxed, your hands are absolutely neutral, and your elbows at 90 degrees. Now you don't need a protractor to measure all this. Basically, your arms, they should be parallel to the ground, and the upper arm should be fairly vertical when you look at a good sitting posture. Also remember not to slouch or slump. Slouching is you sit in your chair as if you're going to lie down, and slumping is when you hunch forward when you look onto your monitor. Both are not advisable. Sit as erect as possible. Keep your lower back supported. Just check that your knees and hips are aligned. Your your upper thighs, your thighs are parallel to the ground, and knees are fully rested. If your knees don't reach the ground, might as well use a footrest, because you have to now look at the height of your chair. The chair is a very important component. People don't give it importance. Some people use plastic chairs and so on. Remember that you are spending a third of your life on your chair. So it's worthwhile to invest in a good ergonomic chair, and which has height adjustability and stability below. Raise and lower the chair height. Many of these chairs have adjustable armrests and seats. This is called the backrest, and it should support your lower back. The chair should be at such a height so that your feet are rested on the ground. The the keyboard is at around elbow level, and your eyes come to the. You may have to do a little bit of trial and error here and there, but once you do these changes, you might as well lock the positions, because if you are using the same chair all the time. So these are some of the guidelines. It's not that you need to sit like a robot all the time. You can actually find most what is comfortable, but remember, the most comfortable position lying down. Parameters, which is the most comfortable position, and also you need to sit. The World Health Organization and OSHA guidelines recommend about 5 minutes of exercise, which are called computer break exercise. And these break exercises need to be done every 55 minutes and by rotation. You can exercise your neck, you can exercise your shoulders, you can exercise your elbows, your wrists, your palms, your fingers, and then actually you can walk around and give some we're not talking of the other exercises. There are exercises by, we've got other speakers who will be talking to you about other forms of exercises. But in the office or at work, there are certain stretches that you can do to keep yourself free of pain. So, as I said earlier, physiotherapy has a major role in treating some of these pains and aches. And so a triad of good posture, good workstation planning. Of course, workstation need not be only the computer and your laptop and your chair. It could be many other things, like the seat in when you're watching TV, or the seat in a place where you go and do some activity like a cinema theater, or it could be a bus or a train where you travel. All these things, we should have some idea about good posture and prevention of low back pain and musculoskeletal problems. Of course, exercise is very important, but that is a little outside the purview of my talk. Thank you very much.
Thank you, sir. It was really a wonderful talk.
Thank you, sir,
Once
for
again,
a
thank you.
wonderful
Thank you very much
session.
for enlightening us on workplace
Thank you very
ergonomics
much.
and musculoskeletal pain, which is a more common now and needed one. Once again, thank you very much for your kind time and your presence and bless us. Thank you, sir. Once again, thank you very much. The next talk will be by Dr. Guru Murugan, physiotherapy exercise for COVID patients. Before going into the talk, we'll have a brief introduction, Guru.
The next speaker of the day is Dr. A. Gurumurugan. Dr. A. Gurumurugan, physiotherapist with BPT and MPT qualification from Tamil Nadu Dr. MGR Medical University, Chennai. He has specialized in hospital management and done his MBA in hospital management from Alagappa University, Karaikudi, Tamil Nadu. He has successfully completed his full-time PhD from Madurai Kamaraj University and the PhD was awarded in June 2015. He has successfully completed his postgraduate diploma in medical legal aspects from Tamil Nadu Dr. Ambedkar Law University, Chennai, Tamil Nadu.
Hmm?
Reconnect ஆயிடுச்சு நம்மளுது. அவங்க அன்மியூட் பண்ண சொல்லு. சொல்லுப்பா.
Hello. Sir, I was cut. Just give me unmute and give the again go host permission.
நெட்வொர்க் அப்படி மாறி தான் வரும்.
Network.
ஸ்ட்ராங்கா இல்லைனா.
இருக்குதுன்னு சொன்னீங்க.
இருக்குப்பா, சிக்னல் வரணும்ல நல்லா. Sorry for the inconvenience. Dr. Gurumurugan can start the presentation. சொல்லிடு அவ்வளவுதான்.
முடிஞ்சிச்சு அவருக்கு. சொல்லு. Sorry for the inconveniences. I request Dr. Gurumurugan to start the presentation. Dr. Guru sir.
Unable to speak.
Dr. Murugan, are you able to speak now?
Hi, yes, sir.
Yeah, you are very much audible.
Okay. So good evening to one and all person here.
Good evening, sir.
Good evening. Wish you happy World Physiotherapy Day for all the physiotherapists. First of all, I thank to Mr. A.Mahalingam, sir, the Managing Director and Joint Academy, and Dr. Vikash Agarwal, the President of Lions Club, Road Club Brain, for having been invited to me this webinar. On this occasion of World Physiotherapy Day, indeed, it is a great opportunity to exchange
I
exchange
think
views
someone's
on.
speaker is on. Kindly, someone please.
Yes, sir.
Uh,
Thank you, sir.
Yeah. Thank you.
Excuse me, Dr. Guru.
It's a great opportunity to
Dr.
exchange
Guru, good evening.
views on.
There is some noises in your side.
Yes, sir. Good
Some
evening, sir.
noises is from your side. I think hope your system and mobile both are on.
Okay, sir.
Okay, carry on.
Okay, sir. I correct it, sir. Okay. It's great opportunity to exchange views on the COVID-19 between the medical professionals across India. So the next go for my topic. Can you able to see my BPT?
Yes, sir. Yeah.
Yes, sir.
Yes, sir. So the human body is
Sujay,
so
Sujay,
physiotherapy
Sujay,
exercise for the COVID patients, the
Daddy, come
interaction
la.
that works the interdependently. So each system is associated with a specific function that is the normally essential for the well-being of the individuals. So the group of atoms and molecules they combine to form the cells and tissues. The group of cells and tissues is to form the human organs. The organs are the combined to the form the number of different types of system. The system they consist of the number of organs and tissues that together they contribute to one or more survival needs of the body. Hello, it's audible?
Yes, sir. Yes, sir. Carry on.
Hello?
Yes, sir. Carry
Yes,
on.
yes.
We are able to hearing.
Yes.
Yes, sir. Carry
Okay,
on.
so the system they consist of the number of
Only you
organs
can
and tissues.
slow down your computer's speaker volume, sir, so that your voice will not echo.
Okay.
Yeah, you are speaking from your microphone, so you can reduce the volume of your computer speaker, so that your voice will be more clear.
Okay, sir. Okay, fine.
Yeah,
Okay.
please.
So the
Thank you.
level of thank you. So the structure and functions of the respiratory system. The cells of the body need the energy for all the metabolic activities. The most of the energy is derived from the chemical reaction and the oxygen and carbon dioxide. The respiratory system provides the route by which supply of the oxygen is present in the atmospheric air enter into the body, and it provides the route of exhaustion for the carbon dioxide. So this is the structure of the respiratory system. And the from the nose to the trachea it is called the upper respiratory system, and the below the trachea to the alveoli it is called the lower respiratory system. So these systems are the nose, pharynx, larynx, trachea, and two bronchi and bronchioles, and the small air batches, and the two lungs that are covering, and it is called as the pleura. So the muscles of respiration it is the intercostal muscles and the external intercostal muscles and internal intercostal muscles. The primary muscle for respiration is the diaphragm. So the case in the exchanges they taken the pleura. So the deoxygenated blood is converted into oxygenated blood by the deoxygenated air. The remaining of the CO2 air they expel from the lungs to the external environment. It is called as the blood purification. The blood purification takes place only in the lungs. So the COVID in 19, there are the stages of mild COVID, moderate and severe. The SARS-CoV starts the journey in the nose, mouth, and eyes. They travel down to the alveoli in the lungs. The alveoli are the tiny sacs or air where gas exchanges occurs. The impaired case exchange. When the immune system attacks or the infection, it also kills the healthy alveoli cells. This results in the three things that hinder gas exchange. So these are the proteins with the fluids, the fluid filtering the industrium, the loss of the surfactants, then these are the neutrophils. So alveolar collapse due to the loss of surfactants from the type 2 cells. So less oxygen enter into the bloodstreams due to the lack of the type 1 cells. So more fluid enter into the alveolar. This is the fibrosis of these all alveolar the impair of the gas exchange between the blood vessels and alveoli. So the immune response after infection, the type 2 cells release the immunoinflammatory signals and macrophages and the cytokines to the workers with the infected person. The contact with the contaminated objects or surface, the virus enters the body through nose and mouth and eyes. So the respiratory diseases can range from more severe diseases. Example, the MERS and SARS. So MERS COVID, its Middle East respiratory system and the acute respiratory syndrome. So this coronavirus from the bat. The intermediate course is MERS COVID is camel and the SARS-CoV is the civet cat. So the mode of transmission is the close contact with the mucus of the another person. The final course is human. So nowadays the main reason for the coronavirus is the human to human is main cause for the affecting the coronavirus. The clinical presentation of the MAC coronavirus is the fever, cough, and shortness of breath and fatigue. Center for Disease Control is adds new symptoms. It lists the loss of taste or smell, muscle pain, chills, the repeated shaking with the cells and headache and sore throats. So the upper respiratory tract infections like common cold, tonsillitis, and the sinusitis and the laryngitis. So upper respiratory tract infections are the highly contagious in nature. The virus can spread from one person to the another person due to the contact or even due to the sneezing or coughing. So lower respiratory tract infections like the tuberculosis and some say. So higher risk population for the COVID is the older people. Another one, the people, the serious chronic illness like diabetes, cardiovascular disease, chronic respiratory disease, cancer, hypertension, and the chronic liver disease. So what we do by physiotherapy? So the physiotherapy is a treatment to restore, maintain, to make the most of the patient's mobility, functions, and well-being. So physiotherapy helps through the physical rehabilitation, the injury prevention, and the health and fitness. And the physiotherapist get you involved your own recovery. So the therapy is geriatric and sports and orthopedic and pediatric physiotherapy. What do you mean by exercise therapy? The exercise therapy, what we will do, the exercise therapy means the accelerating the patient's which have the alter is the normal way of living. So the movements given to by the another person is the patient can't able to do something. It means the passive movements. The patient could operate active movements. So types of therapeutic exercise in breathing exercise, stretching exercise, aerobics exercise, balancing exercise, aquatic exercise. What do you mean by breathing exercise? The when the diaphragm is functionally effectively, its role for the primary muscle for expansion. So ventilation is the efficient for the breathing exercise is very important. So the aims of breathing exercise to
அதனால 3 மறுபடியும் போயிடுச்சு. இப்ப பாரு கனெக்ட் அது ஆகும்பா அப்படிதான். நம்ம எதுவுமே பண்ண முடியாது. அதுவா ரீகனெக்ட்
பட் அங்க
ஆகும்.
ஓடிட்டு இருக்குங்க.
அதெல்லாம் போயிட்டு தான் இருக்கும். அவங்கெல்லாம் போயிட்டு தான் இருப்பாங்க. யூடியூப் ஸ்ட்ரீமிங் போயிட்டு இருக்கும். நம்மளுக்கு மட்டும் விட்டு விட்டு வருது.
பேசாம இன்னொரு மொபைல் எடுத்து கனெக்ட் பண்ணேன்.
இந்த எங்க இருக்கு மெயின் மொபைல்? அதுல கனெக்டடா இருக்கு. நீ போ, அது வந்துச்சு.
procedure for the relaxed half-lying position. On inspiration, the upper abdomen and the lower chest should be seen. To expand the rise slightly, it means the optic fast. To sink down again the passive fast. To guide the
எதுக்குப்பா பண்றா? அப்ப அது அதுல இருந்து போயிருக்கும்னு நினைக்கிறேன்.
place on hand on the upper abdomen. So thoracic expansion exercise, the position for the half-lying position. It's a tactile stimulation to the encourage the thoracic expansion. Just to palpate the lower thoracic region, upper thoracic region. Thoracic expansion technique. There are two types of techniques. One the upper costal breathing exercise and the lower costal breathing exercise. So when the patient is encouraged to the breathe in slowly and deeply as he can through the nose and followed by the relaxation passively as he can through the nose and followed by the relaxation passive expiration via the mouth. So forced expiration technique is nothing but the patient is instructed to take the medium size breathe in followed by a lightly forced expiration throughout the open mouth and close. So it is usual to perform one or more cups followed by a period. So active cycle of breathing is combined to above that I said that techniques it is called as the active cycle of breathing. This followed by the 3 or 4 thoracic expansion exercise to mobilize the secretion in the smaller bronchi. The forced expiration technique from mid to low lung volume may then move the secretion proximally, and this is may stimulate the cough, and alternatively, a cough from a high lung volume may remove the secretions. So types of breathing exercise, the diaphragmatic and pursed width breathing and segmental breathing and a glossopharyngeal breathing exercise. So next we will see about the diaphragmatic breathing
இதுலவா?
involves the contraction of the diaphragm muscle, the expansion of the belly. So this exercise is otherwise known as the belly breathing. So the deepening in inhalation and exhalation, which consequently decreases the respiration frequency, which maximize the amount of the blood cancers to improve the blood cancers at the alveoli to the capillaries. So put on hand your chest, the place the other on your stomach. Take a number two, take a breathe and feeling your stomach and move outward. So breathe out of oxygenation and ventilation. So this technique requires a person to inspire through the nose and exhale through the mouth at a slow in controlled in manners. So segmental breathing exercise, it is a apical breathing exercise. This is the upper apical breathing exercise is a pattern of birth that contains the most movement of the upper chest. So lateral costal expansion, the lateral costal breathing refers to side exertion in the rib cage with each exhale. So the posterior and facial expansion, this it's very useful for the post-surgical patients and also usually in the corona patients. The closopharyngeal breathing, it is always known as the frog breathing. It is a positive pressure breathing method using muscles of mouth and pharynx to boost the volume of air. It will help to the lungs. It is called as the closopharyngeal breathing. It's very, very important for the breathing control. Then the specific physiotherapy technique is the incentive spirometers. So inspiration and expiration muscles like the diaphragm and intercostal muscles and external intercostal muscles, all muscles are strengthened by the spirometer. So performing the spirometer, the preparation, they explain the purpose of the test and demonstrate the procedure. So record the patient age, height, gender, and enter the spirometers. Note when the bronchodilator was last used, have the patient sitting it comfortably. So loosen any tight clothing, the empty the bladder forehead if needed. So the incentive spirometer is the client the floor position. Ask the client to seal the lips around the mouthpiece. They inhale slowly through the mouth. They hold the breath for 2 or 3 seconds. They have the client observe his progress by watching the ball elevate. So exhale slowly around the mouthpiece. They repeat the procedure for 5 to 10 minutes for every 1 or 2 hours as per the physician order or and also the physiotherapist. Then already I said that the deep breathing program and the cuffing technique already. The cuffing technique is nothing but inhale the take in this slightly and a deeper breath than normal. The blow out the air even breath. That is the cuffing technique. So I would like public the awareness to the COVID patients how to make the breathing exercise program. This should be done for any person's interaction to be in clinic or the phone or via the digital consultation. The physiotherapist as well the place to provide should be the proactive offering the health maintenance study. Physical activities and the mobility exercise is very very important for the recovering the coronavirus disease. The every exercise should be repeated in the 10 to 15 minutes. The begin with one set, then the proper to 2 sets. It should be done at the 3 or 4 times per day. So, for example, the ankle toe movements early morning, you wake up, you do that the ankle toe movements, then the hip flexor exercise. These exercises to facilitate your the mobility of your body and to you will improve your the quality of life. Then sit to stand. So you can practice sit to stand activity from a chair for a minute. Use support as needed as you are the age according to the age related. So your therapist will advise you on the exercise to improving strength and endurance. Then the walking. The starting walking in short bursts at least for 10 minutes. The gradually increase walking time to the 20 minutes. Take the rest pause. So good nutrition is key to boosting immunity. So the nutrition like the green color fruits, like the other green leaves, all things are you should take for the boosting the immunity. So sleep. The sleep is maintaining the north sleep pattern. You should you may improve your immune system, the mind. So, if you having any physical disturbance, automatically it leads to the mental problems. So, physical is very, very important for the practicing the relaxation. Then, home care and follow. So, do stay away from others and isolate in one room and use the separate bathrooms if available. So wear a covering over your nose and mouth. The wash can soften with a soap with the water for at least 20 seconds with an alcohol-based hand sanitizer with contain at least 60% of alcohol. Don't use if the public areas don't use the public transportation. They don't touch eyes, nose, mouth, and unwash the hands. The healthy lifestyle is please don't avoid the alcoholic and smoking. It's very important one for the good health. Those hand washing. So 7 steps for hand washing. Number one step: rub palms together. The rub the back of the both hands. Then they interlace the fingers and rub the hands together. They interlace the fingers and rub the back of the fingers of both hands. They rub the thumb in the rotating manner followed by the area between the index finger and the thumb of the both hands. The next they rub the fingertips on palm on the both hands. The rub both wrist in the rotating manner. This step is very very essential for daily to early morning, early evening. It's whenever you free, whenever you did whatever, then you do the hand washing is very very important. Then the cupping and sneezing etiquette, they use their tissue for this position. They use the upper sleeve. This is the basic and the cough and sneezing etiquette for this to prevent the infection from others. So general instructions. So do not exercise or exert after heavy meals. To slow down your activities if breathe less. Talk to friends and family members and other medical directors. Then when on oxygen, it's monitored closely. Thank you. So thank you for everybody.
Thank you, Dr. Guru Murugan, for discussing various important exercise for our normal activities, especially for the COVID.
Thank you so much, sir.
Your topic also related to the current year theme, Therapy Day. Thank you once again. So next session we move on to a role of physiotherapy for healthy lifestyle by Dr. S. Kavita, Assistant Professor and Consultant, Adi Barasakti College of Physiotherapy. Dr. S. Kavita, Assistant Professor and Consultant, Adi Barasakti College of Physiotherapy, Melmarutur, and also Consultant at Melmarutur Adi Barasakti Institute of Medical Science and Research, Mappings.
The next speaker of the day is Dr. S. Kavita. Dr. S. Kavita holds a post-graduation in the field of Advanced Physiotherapy Management in Neurology from the Tamil Nadu Dr. NGR Medical University. She has specialized in neuro and neuropsychiatric rehabilitation, which are the recent trends of physiotherapy. She is also a life member of World Confederation of Physiotherapy, Indian Association of Physiotherapy, and Tamil Nadu Association of Physiotherapy. 50,000 patients who have neuropsychiatric problems. She also has conducted many physiotherapy camps and rendered health education talks among village people, school and college students and institutions. We feel happy to welcome you and over to you, ma'am.
Welcome, Dr. Kavita. Please go ahead. Please go ahead for your presentation.
So this is the special day. I am grateful to the Almighty God who have given this opportunity. My special thanks to Mr. Mahalingam sir and Dr. Vikesh Agarwal sir. Today we think about the role of physiotherapy for healthy lifestyle. So before going to think about this topic, so we have to understand first what is health. Is it audible, sir?
Yes, madam, very much.
Yes.
Both the presentation also
Go ahead.
able to see. Yes, presentation and your voice both are clear. Go ahead, madam.
Okay, thank you, sir. Today, first we should understand health. What is health? Health, no disease. So a good physique? No. So health is nothing but physical, mental, and social well-being. A person with good physique, with strong mental ability, and play an important social role. So that person should be considered as a healthy person. Okay. So for a healthy person, we should focus on our physical body, our mental health, and our social role. Okay. So first we understand about health, then how we lead to a healthy life. So this is our topic, no? So for a healthy lifestyle, there are three important contributing factors for leading a healthy lifestyle. First one is physical activity. Physical activity is nothing but the exercise plus our daily routine, the activity which are involved by our physical body. And next thing is diet, and third thing is mental relaxation. These three important topics are very important for leading a healthy lifestyle. So before going to know about physical activity, first we should know about benefits of exercise. Okay, so that's why we have to engage into a exercise. So first we have about the benefits of exercise. So there are so many benefits all over our body. So various systems of our body. So first we should take about the musculoskeletal system. For musculoskeletal system, the exercise should strengthen up the muscles. It will improve the power and endurance of the muscle, and it will maintaining the muscle property. And for cardiovascular, it will improve the cardiovascular endurance, and it will regulate the blood pressure and heart rate. Then for respiratory system, so the oxygen consumption is more by doing regular exercises. The cardiovascular endurance again, and respiratory oxygen diffusing capacity and VO2 max will be increased by the regular exercises. Then oxygen diffusing capacity also increased. So we have to maintain proper physique, body physique. Okay. So these are the some effect and uses, and one important thing is, so it will regulate the hormones of our body. So it will most of the females have a problem with the hormonal imbalance. So the regular exercises should reduce these complications. So and it will also improve the joint mobility. Okay. So improper joint mobility can lead to the muscle spasm and joint stiffness. Okay. So regular exercises improves the joint mobility and maintain the muscle property. And for the nervous system, it will gives you a good sleep. So it will reduce the stress hormone level, and it will promote a good sleep. So good sleep is very important for maintaining the mental relaxation. First, we should three factors. First, already we say physical activity, diet, and mental relaxation are more important for maintaining a healthy lifestyle. So, physical activity and diet both are whether balanced or imbalanced. How we know? By using BMI, that is body mass index. Okay, so body mass index is not an accurate thing, so it is a just, it will provide a guideline to you whether your intake of food and your physical activity is balanced or unbalanced. Okay, then how you know? So by your BMI, so first is your physical activity. If you are doing a physical activity, then your diet is poor, then you have BMI is underweight. BMI is under this category. Okay. So this kind of people doing resisted exercises. Resisted exercises is nothing but the exercises performed repeated curves, therabands, and we can use dumbbells, whatever it's saying. So swimming also, yeah, example for resisted both well as assisted exercises. So we can use resisted exercises for if the people have a underweight category. Next we have to, if your food and your physical activity both are in same, okay, if this both are balanced, that we have a very good BMI, that is normal BMI. So that we have to coming this group. So this kind of people selected exercises, that is called as free exercises. Free exercises are nothing but the exercises should be done without resistance. For example, I am just bending my elbow. So this is the free exercises. Just you have to do the movements of your joints. That is called as free exercises. So the normal people will follow free exercises for maintaining the physique. Next category, the food intake and your physical activity. The food intake and physical activity are imbalanced. So your physical activity should be very less and your food intake is very high. So what will happen? There is an imbalance between these two categories. So that will creates overweight, obese, and extremely obese. So first you have to just check out your BMI. So BMI does not tell about the fat deposition. It just tell about your general body status. Okay. So based on occupation, so how we are, which kind of exercise we have to follow, right? So it's not a protocol, just I give the guideline to you. Physical activity is nothing but exercise plus daily activities which are involving our body. Okay, so exercise plus regular activities which are involving our physique, that is called as physical activity. So for the for IT firms and for yes, is it okay? Is it clear, sir?
Yes, yes, go ahead.
Okay.
Go ahead.
For white collar job. Okay, thank you, sir. For white collar jobs, so they have less physical activity comparatively to the mental activity. They have a mental stress and they have a mental work. For working hours of 8 hours, they have a mentally work. Simply they are sitting. Okay. So the physical activity very less and mental activity should be high. So sedentary life, the people with sedentary lifestyle and white collar jobs should select the increasing of the physical activity. How means daily doing walking for half an hour. Okay. So I personally suggest you 8 walking is very, very effective, right? So you have to spend some time to your body to maintain your physical health, right? So doing physical activity. Okay, so first this category, and next category is agricultural activities. The occupation which are involving more physical activity comparatively to that of the mental activity. That group of people should select breathing exercises and relaxation techniques. So Guru Murugan sir already said so many breathing exercises. Okay, So you should follow breathing exercises. You have to expand your lungs. You have to improve your cardiovascular endurance. So if the people have more physical activity, you have to do relaxation technique, Jacobson relaxation technique, Savahasana, and there are so and so many relaxation techniques are there. So you can use that. And next category is women are so special category, right? If the women are going for a job or an house homemaker, so they have play important role in the family and outside of the family, so they have to put more important to maintaining their health. Okay, so for those people, they have to, if they are involving more physical activity in the home itself, you can walk for at least half an hour, and you have to breathing techniques, you have to relax by yourself, and you have to do relaxation techniques also. And one special technique I have to suggest you, I have to personally suggest you, is the counter force reaction technique. That is nothing but, if you are bending for a prolonged period of time for cooking activities and for washing clothes or etc., you have to bend your back, just you have to counter forces. Okay, so you have to just lie down on your bed, and you have to maintain your spine in boat shaped. Okay, so just prone lying, so you have to maintain the prone lying position for just 10 minutes. So it is the counter effect. Okay, so counter force technique, so you have to use that counter force. If you are bending your knees for a long period of time, you have to just stretch it. Okay, so that is called as counter force technique. This is very helpful for the women's. Okay, and one another special category is children. So children are playing, enjoying for playing, so that is good. If some children are not able to play outside, okay, so they have to do general joint mobility exercise. Joint mobility exercise is nothing but just bend your elbow and just raising up of your arms. This is a very simple exercises they have to do. And breathing techniques is also very useful for the children also. Okay, so breathing technique in this pandemic situation, so we must do breathing techniques, and all category of people will kindly do that breathing exercises. That is very, very important thing.
Thank you, Dr. Kavita Madam, for briefing us
Thank you,
on
sir.
the role of physiotherapy for healthy lifestyle. Healthy lifestyle has become a careless thing in this generation. Thank you for briefing all the important lifestyle, that is physical, mental and social aspects related to definition of health according to WHO. Now, the last part of session today is on fast track rehabilitation after total knee replacement by Dr. Sadish, a senior most orthopedic surgeon from Coimbatore.
Speaker of the day is Dr. B.R.J. Satish Kumar. Dr. B.R.J. Satish Kumar is interested in artificial knee, hip, shoulder and elbow replacements, complex trauma and pediatric orthopedics. He is a life member of Indian Orthopedic Association, Indian Arthroscopy Association, Tamil Nadu Orthopedic Association, Asia Pacific Orthopedic Association, SIPCOT Organization, Belgium. He has also published several research publications in both national and international journals. His article on Special Technique on Joint Replacement for Knock Knee has got published in the prestigious US journal named Journal of Bone and Joint Surgery, Essential Surgical Technique section. He is also a recipient of gold medal in DNB Ortho exam, Best Clinical Research Paper in 2013 by Indian Journal of Orthopedics Dr. Baxi Award. He is also specialized in complex deformity correction of limbs and legs in children and adults, including limb and bone lengthening. He is committed to community programs, delivered health education talks, people forums, colleges, and institutions.
Hello.
His team has
Good evening, sir.
Good evening. Is it audible?
Yeah, everything is audible, sir.
Can you proceed?
Dr.
Sure,
Satish,
sir.
good evening. Please go ahead for your presentation.
Yeah. Good. Yeah. Good evening, senior members, doctors, therapists, and friends. So this is Dr. B.R.J. Satish Kumar from Coimbatore, and I'm going to talk a little bit on total knee replacement surgery. Okay. So we all know that joint replacement is a very successful procedure. It is recommended for all end-stage arthritis. The arthritis can be because of degenerative arthritis or rheumatoid arthritis or maybe post-traumatic arthritis. For most of the end-stage arthritis where there is no cartilage, I think that can be very efficiently replaced with implants. So this is very successful not only in knee and hip, but we routinely do shoulder and elbow replacements also. So I have been doing this joint replacement for the past nearly 20 years. So joint replacement as such is a very successful procedure in terms of pain relief, deformity correction, and function. The numbers of total knee replacements is increasing because of increasing population, increasing lifespan, and expanded indications, and more surgeons are doing. Patients are now more aware of the procedures. Advancements are being made from time to time, which is concerned with the implant design or computer navigation, what we call, and the anesthesia advancements. So we know essentially the ends of the bone are replaced with implant in knee replacement. On the femoral side, it is replaced with metal. It can be cobalt, chrome, or oxygen. On the tibial side, it is replaced with a metal. On top of it sits what is called a medical grade, ultra high molecular weight, ultra high density polymer. A few cases before going. This is a patient with a severe varus deformity, 83 years old, and this is the pre-op X-ray. You can see there is absolutely no joint space. The pre-operative walking, very difficult walking. You can see complete loss of cartilage here, the aberrated subchondral bone, and the total replacement is done in this patient. Bilateral knee replacement has been done, and the patient is walking on second post-op day.
Then you can close the.
Sorry, some videos are not working. So we can guarantee that a patient will have very minimal pain. Many patients don't even complain. And in previous years, I think William must be knowing, chief therapist, he must be knowing that say 4 or 5 years back, at least for every 10 patients, 2 patients will cry in the post-operative ward because of pain. Now, in the past 5 years, I have not seen any patient cry with pain in the post-operative period. That is the effectiveness of this protocol. Patient can be, if single side is done, patient can be discharged on third or fourth day. So thank you very much. I'll be willing to take that.
Thank you, Dr. Satish sir, for your excellent presentation. Fast track rehabilitation and various aspects of care for orthopedic patients. I would like to thank you and Mr. Michael for coordinating this program. I would like to thank for both. I request Dr. Vikash for giving a concluding remarks and also to introduce few other important persons from the Lions Club. Over to.
Thank you so much, sir. Hello.
Yes, sir. Go ahead.
Am I audible?
Yes, sir. Yeah, please.
Yeah. So, it's my privilege to have been asked to give a vote of thanks on this occasion. And I, on behalf of entire team of Lions Club of Raulkela Prime, extend a very hearty vote of thanks to the honorable speakers who blessed us with their presence and took out valuable time of their busy schedule. I must mention our deep sense of appreciation for their work. Uh, I'm very thankful to Dr. S. Sundar, Dr. Guru Murugan, Dr. S. Kavita, and Dr. B.R.J. Satish Kumar, who spoke who gave a very great, shared their great knowledge, which was very, very easy to understand and which will help us in coming days to make ourselves healthy and take care of our health during this pandemic. I also wish to express my gratitude to our Vice District Governor, Lion R.K. Singh ji, and Lion Y.P. Goel, who have been here from the beginning of the session. And I also thank all the members and all the audience who has been over here for last 1.5 hours and has been nicely taking care of this particular knowledge session. As no program can become successful with a single person, so I extend my big thanks to Dr. Mahalingam for his support. Thank you, sir, for making this event successful with your contribution. And without your support, and this was not possible. And once again, I thank everyone for being such a nice audience, and thanks all the speakers for giving their valuable time during this particular pandemic and such a fantastic day. Once again, I wish all of you a World Physiotherapy Day and World Literacy Day. Thank you, sir.
Thank you, sir. Thank you, Dr. Vikash, for arranging this type of program in association with the Twintech Healthcare Academy, Chennai. I also like to thank all the
Thank you.
speakers from once again from my side, Dr. Sundar, for readily accepting our invitation to join, Dr. Guru Murugan, Dr. Kavita Madam, and Dr. Sadish Kumar sir, senior most orthopedic surgeon from Coimbatore. Even in fact, I am meeting Dr. Sadish sir over online now, and it was coordinated by Mr. Michael. Thank you, sir. Thank you very much for accepting and spending your time with us today for the common public cause on this great day. Thank you once again. Have a good day, healthy day, happy physiotherapist day. Thank you all. Thanks
Thank
to all
you.
the members of Lions Club for this excellent arrangement. We will meet soon on another program. Thank you once again.
Thank you very much.
மீட்டிங் ஒரு ஹோஸ்டே க்ளோஸ் பண்ணிட்டாரு அவ்வளோதான்பா